Welcome to the deep dive. Today we're tackling something that might be more common than you think, blepharitis. Basically, inflammation of the eyelid.
That's right.
We've got a really detailed set of information here, some source texts, to help us get beyond just the basic definition and really understand what's going on.
hmm
Our mission for this deep dive is to pull out the most important insights about what causes it, the signs, and, well, what these sources highlight as key.
Exactly. We've been looking at some pretty comprehensive notes that cover blepharitis from, top to bottom, what it is, triggers, how to spot it, what can be done. We want to boil this down.
Okay, let's dive in then. Blepharitis, simply put, is when the eyelid gets inflamed.
Right.
But it's not just the surface skin, is it? It can go deeper, muscle, connective tissue, those important glands in there.
Yeah, absolutely. And it often affects the inner lining, too, the palpebral conjunctiva.
And the info we have splits it into two main types, anterior and posterior.
Correct. Anterior is often linked to bacteria or even just like self-trauma from rubbing. Posterior seems more tied to those meibomian glands malfunctioning.
Okay, meibomian glands. We'll definitely come back to those. So what's actually happening when it gets inflamed? Is it like skin inflammation elsewhere?
Pretty much, yeah. The basic mechanisms are similar: immune response, infection, maybe injury, even other health stuff going on.
But the eyelid reacts more strongly sometimes.
It can, yeah.
Yeah.
It's packed with these things called mast cells, and it has a really dense blood supply.
Yeah.
So, yeah, the inflammation can sometimes be a bit exaggerated.
Right, small trigger, big reaction. Okay, back to those meibomian glands. You said they're key for posterior blepharitis.
Definitely central. Meibomian gland dysfunction, or MGD, when they're not working right, it seems to kick off a whole cascade.
How so?
Well, bacteria get involved. They produce these enzymes, lipases, that actually change the lipids, the oily stuff, in the glands.
So the oil gets messed up.
Exactly. It can get thicker, cause plugs. Think of it like, I don't know, pipes getting clogged.
Okay, makes sense.
And it doesn't stop there. These bacterial enzymes also create irritating fatty acids, so more inflammation. Plus, it makes a better environment for more bacteria to grow. Vicious cycle.
And this affects the tears.
Absolutely. If the glands aren't putting out the right kind of oil, the tear film becomes unstable. That can cause dryness, irritation, the whole 9 yards. So yeah, blepharitis is squarely in the ophthalmic, the eye health category.
Right, got it. So we know what it is generally. What are the actual signs? What might you see if an animal has this? Sounds like quite a few things.
Oh, definitely. The notes list several telltale signs. You might see ocular discharge, could be watery, could be mucus-like, or even thick, kind of yellowish mucopurulent stuff.
Yuck.
Eyelid twitching or spasms, that's called blepharospasm, that's another clue.
Just constant irritation making it twitch.
Pretty much. And visually, the eyelids themselves might look red, what we call hyperemic, or swollen edema, or just generally thickened.
And I bet it's itchy.
Bingo. Pruritus, that intense itch, is super common, which, of course, leads to scratching, excoriation, and that just makes the inflammation worse.
The classic itch-scratch cycle.
Exactly. And the effects can go beyond just redness. The notes mention changes in skin color, pigmentation, sometimes depigmentation, even hair loss, alopecia around the lids.
Oh, okay.
And specific signs related to those meibomian glands again. They might look swollen, kind of cream-colored. The little openings along the lid margin might be raised, like tiny pinpricks.
You can actually see the gland openings being abnormal.
Sometimes, yeah. You might also see more obvious things like little abscesses, scales, crusts forming, or even small bumps called papules or pustules.
So quite a range of lesions.
Definitely. And sometimes nodular swellings, these red lumps, single or multiple. Plus, it often goes hand in hand with conjunctivitis inflammation of the conjunctiva or keratitis, which is inflammation of the cornea.
So the inflammation can spread. Makes sense. Now, you found a really interesting detail about specific cats.
Oh, yeah, this is fascinating. In Siamese-type cats, with the points, if they get chronic blepharitis, the hair on the affected eyelids can actually lighten.
Lightened? Why?
Apparently, it's due to the increased skin temperature in that area from the chronic inflammation. Isn't that something?
That is something. Okay, so lots of signs to watch for. Let's unpack the why. What actually causes blepharitis? The sources seem to break it down.
They do, which is helpful because there are so many potential causes. We can group them roughly into like congenital issues, allergies, bacteria, tumors, and then a whole bunch of other miscellaneous things.
Okay, starting with congenital. These are things they're born with or related to their anatomy.
Exactly. Eyelid abnormalities that might, say, promote self-trauma because things are rubbing, or maybe create moist dermatitis because folds hold moisture.
And certain breeds are more prone.
Oh, definitely. The list is quite long. Things like prominent nasal folds or eyelids turning inwards. That's medial trichtiasis is just hairs, or lower lid entropion if the whole lid rolls in. You see that in breeds like Shih Tzus, Pekingese, English Bulldogs, Lhasa Apsos, Pugs, also Persian and Himalayan cats.
Right, those breeds with the pushed-in faces or lots of skin folds.
Precisely. Then there's distichia eyelashes growing from the wrong spot, like the meibomian gland openings, common in Shih Tzus, Pugs, Goldens, Labs, Poodles, Bulldogs again. Ectopic cilia are similar, hairs growing from the inside of the lid.
Ouch, that sounds uncomfortable.
It really can be. Lateral lid entropion, where the outer part of the lid rolls in. You see that in Sharpies, Chow Chows, Labs, Rottweilers. Less common in adult cats, apparently.
So many specific breed links.
It really highlights the genetic component. Then there's legophthalmos, can't close the eyelids completely, seen in those brachycephalic dogs, the flat-faced ones, and also Persian, Himalayan, and Burmese cats.
And long-nosed dogs aren't immune either.
Nope. The leukocephalic breeds can get deep medial canthal pockets, little pouches near the inner corner that trap stuff, and dermoids, bits of skin in weird places like on the eye or lid, can happen in Rottweilers, Dachshunds, Burmese cats, others too.
Wow. Okay, so anatomy plays a huge role. What about allergies?
Allergies are another big category. The notes mention 4 types of hypersensitivity, but the gist is the immune system is overreacting.
Like what kind of reactions?
Type I is immediate think a tuppy, like pet hay fever, food allergies, insect bites, inhaled stuff. Interestingly, also a hypersensitivity to Staphylococcus bacteria.
Staph again. Seems to pop up a lot.
It really does. Type 2 is cytotoxic, seen in some autoimmune conditions like pemphigus and drug reactions. Type 3 involves immune complexes, think lupus, again staph hypersensitivity, drug reactions. And type 4 is delayed, like contact allergies, flea bite sensitivity, and surprise, surprise, drug eruptions again.
So the immune system can really drive this inflammation in different ways. Okay, next category, bacterial causes.
Right, so you can get localized infections. A hordeolum, which most people call a stye. External ones affect glands near the lashes, often in younger dogs. Internal ones involve those meibomian glands, more common in older dogs, usually staph causing it.
Staph is just everywhere in this story.
Seems like it. And you can also get more generalized bacterial blepharitis or meibomianitis, inflammation of the glands themselves, often staphylococcus or streptococcus.
Any other bacterial issues?
Yeah, paragranulomas, a specific kind of inflammation, and again, that's staphylococcus hypersensitivity in both young and old dogs.
Okay. Moving on to neoplastic causes tumors.
Right. The notes mention sebaceous adenomas and adenocarcinomas, which arise from the meibomian glands. Squamous cell carcinoma is another one, particularly mentioned for white cats' sun exposure risk.
Good point. Anything else tumor-wise?
Yeah, interestingly, mast cell tumors can sometimes mimic blepharitis, presenting as just swollen red lesions. So, got to keep cancer on the differential list, especially for non-healing things.
Definitely. Now for the other category. Sounds like a mixed bag.
It really is. External trauma is an obvious one. Lacerations, burns, fungal infections, both superficial stuff like dermatophytosis, ringworm, and deeper systemic fungal diseases can manifest on the eyelids.
And parasites. I feel like they always show up somewhere.
They do. Demodex mites causing dermatocosis, sarcoptic mange mites, even fly larvae like Cuterebra, and notovatrus mites in cats.
Ugh.
And the notes specifically call out one type, Demodex NJ. It seems to really like those sebaceous and meibomian glands. It's linked to MGD, those blocked glands called chalasia, and a specific type of inflammation called granulomatous blepharitis in dogs.
Oh, that might directly impact the glands. Interesting link. What else is in this other bucket?
Nutritional factors like zinc-responsive dermatosis in certain breeds or puppies, or fatty acid deficiency. Endocrine disorders too, hypothyroidism and Cushing's in dogs. Sometimes diabetes-related skin issues.
Hormones affecting the eyelids.
Yep. Viral causes are big, especially in cats. Feline herpes virus 1, FHV1, is a major cause of chronic blepharitis.
Ah, FHV1. That explains a lot of chronic cat eye issues.
It certainly does. Then there are simple irritants reactions to topical eye drugs, even things like nicotine smoke. A specific surgery, parotid duct transposition, can sometimes cause irritation afterwards.
Okay, keep going.
Genetic conditions like familial canine dermatomyositis in collies and shelties, another condition called colligranuloma. Eosinophilic granuloma complex in cats can involve the eyelids.
So immune and genetic factors overlapping here too.
Absolutely. And simple mechanical irritation from tear overflow or post-tear burn. Also, existing eye problems like conjunctivitis, keratitis, dry eye, dacryocystitis, tear ducts inflammation, even orbital disease behind the eye can all be associated with blepharitis.
It's like anything going wrong near the eye can affect the lids.
Pretty much. Even radiotherapy or contact with irritating drugs like neomycin. And finally, sometimes they just don't know the cause. Idiopathic, especially noted in cats with chronic conjunctivitis like Persians and Himalayans.
Wow. That is an incredibly long list of potential causes. It really drives home how complex this can be. So, given all that, what makes an animal more likely to get blepharitis? Any key risk factors?
Well, as we touched on, breed predisposition is huge. If you're a breed prone to entropion or other congenital lid issues, your risk is higher.
Makes sense.
The notes also suggest hypothyroidism in dogs might make them more prone to chronic bacterial issues, potentially including blepharitis,
Okay, the thyroid link.
and canine seborrhea, that oily, scaly skin condition, might predispose dogs to chronic meibomian gland inflammation and also make them more susceptible to that Demodex mite we mentioned.
Interesting connections.
Mhm.
So recognizing these underlying risks is important. Okay, how do vets actually figure out, yes, this is blepharitis and this is likely why? Diagnosis time.
Right. Well, often the clinical signs themselves are pretty suggestive. You see the red, swollen, crusty eyelids, you're thinking blepharitis.
But that doesn't tell you the cause.
Exactly. Routine blood work, urine tests. Usually not that helpful unless you suspect a systemic metabolic thing, like diabetes may be causing skin issues.
So general bloods are often normal.
Usually, yeah. But if you do suspect something systemic, like low thyroid, then specific tests like thyroid levels are definitely needed.
What about tests specific to the eyes and lids? The notes mention being careful about eye drops before testing.
Yes, that's important. If you're planning to take a culture sample, you ideally want to avoid topical anesthetics or fluorescein dye beforehand because they might mess with the results.
Good tip. So what tests do they do?
Cytology is really valuable, looking at cells under the microscope.
How do they get the cells?
Several ways. Deep skin scrapings, especially if you suspect mites like Demodex. Conjunctival scrapings from the inner lining of the lid to see the types of inflammatory cells. And examining expressed material, gently squeezing discharge from the meibomian glands or pustules.
So getting a look at the cells involved gives clues.
Big time. If you suspect a fungal infection, like ringworm, you do a dermatophyte culture from deep skin scrapings. Sometimes a Wood's lamp, that UV light, can help screen for certain fungi. A KOH prep of scrapings is another quick way to look for fungal bits microscopically.
Okay, checks for fungus, checks for mites. What about bacteria?
If there's discharge or signs of infection, aerobic bacterial culture and sensitivity is key. Sample the exudate, the conjunctiva, maybe expressed meibomian gland material. This identifies the bacteria and, crucially, tells you which antibiotics should work.
But you mentioned a caveat with chronic meibomianitis.
Right. Sometimes, especially if it's thought to be more of a staph hypersensitivity reaction causing chronic MGD, you might not actually culture Staphylococcus itself, even though it's involved in the process. Kind of tricky.
Interesting. And for viruses, like in cats.
For cats with suspected FHV1 or chlamydia, especially if they have conjunctivitis or keratitis, specific tests like IFA or PCR on conjunctival scrapings can identify those bugs.
Got it. So lots of lab tests. What about just looking closely at the eye?
Absolutely crucial. A thorough eye exam is needed to look for underlying problems. Corneal ulcers, foreign bodies, those misdirected eyelashes, distichia, ectopic cilia, dry eye. Using fluorescein stain to check the cornea and doing a Schirmer tear test to measure tear production are standard parts of this.
So you need the full eye workup.
Definitely. And don't forget the bigger picture. A detailed medical history and a full dermatologic exam are vital. Is there skin disease elsewhere? That's a huge clue.
Makes sense. Any other diagnostic tools?
In select cases, especially if things aren't clearing up or a tumor is suspected, a full-thickness wedge biopsy of the eyelid for histopathology might be done.
Taking a little piece to examine?
Exactly. There are also specialized tests like direct immunofluorescence for autoimmune diseases. And if allergies are high on the list, you might consider intradermal skin testing, blood allergy tests like RAST or ELISA, or a food elimination trial.
Allergy testing can get involved.
It can. And the notes make a good point. For really stubborn cases, especially suspected allergies, getting a veterinary dermatologist involved is often a really good move.
Okay, that's a comprehensive diagnostic approach. What about that biopsy, the histopathology? Does it always give the answer?
Not always, interestingly. The notes mention that routine histology might be non-diagnostic in chronic cases. It doesn't always show something specific.
So even a biopsy isn't a guaranteed answer.
Right. It really emphasizes you need to choose when to do a biopsy carefully, based on the whole clinical picture, history, exam, response to initial treatments. It's just one piece of the puzzle.
Okay. So assuming we have a diagnosis or at least a strong suspicion, let's talk treatment and care. Where do you start?
Rule number one, treat the underlying primary disease, whatever that might be. If you don't fix the root cause, you'll just be chasing symptoms.
Makes sense. What about stopping the scratching?
If self-trauma is suspected, an Elizabethan collar, the lovely cone, is often essential to prevent them from making it worse.
Ah, the cone of shame. Necessary evil sometimes.
Sometimes. And here's an important point. Some medications can cause irritation. Certain topical antibiotics like gentamicin, neomycin, terramycin, or even just the ointment base itself can sometimes cause an irritant reaction. So considering stopping a current medication is sometimes part of the plan.
Good point. The treatment itself could be irritating. What about basic hygiene, keeping the area clean?
Super important. Proper eyelid cleansing helps remove crusts, discharge, debris. Warm compresses are great for this. Hold a warm, damp cloth gently against the closed lid for, say, 5 to 15 minutes, maybe 3-4 times a day. Just be careful not to press on the eyeball itself.
What do you use for cleaning?
You can use saline solution, lactated ringer solution, or there are commercial eyelid cleansers available, like eyelid and lash as mentioned as an example. And clipping the hair short around the eyes is usually recommended too, prevents matting and irritation.
Okay, clean and trim. What about diet? Does changing food help?
Only if a food allergy is the diagnosed cause, then yes, a strict hypoallergenic diet trial is the way to go. Otherwise, diet isn't usually a primary treatment.
Right. And for those cats with FHV1, the herpes virus, you mentioned management is key.
Absolutely. Client education is crucial here. Owners need to understand there's no cure, and flare-ups are likely with stress. It's about managing symptoms, reducing stress, maybe using antiviral medications during flare-ups, but it's often a lifelong management situation.
Setting expectations is important there.
Yeah.
Are there surgical options for blepharitis?
Sometimes, yeah. If there's temporary entropion from spasms, especially in puppies, temporary tacking sutures can avert the lid. Lacerations obviously need repair. Large abscesses might need lancing and draining.
What about those blocked glands?
Resistant hordeola or callodsia, those blocked meibomian glands, especially if they're rubbing on the cornea, might need surgical incision and curettage, basically opening them and cleaning them out. And sometimes, manually expressing the infected gunk from meibomian glands can be part of the treatment too.
Okay, so surgery for specific situations. Let's talk medications. Antibiotics seem common.
Very common, especially if bacteria are confirmed or strongly suspected. Systemic antibiotics pills or liquids are often needed to get good levels in the eyelid tissues. Things like amoxicillin clavulanate or cephalexin are common first choices.
Then topical antibiotics too.
Yep. Topical ointments or drops like triple antibiotic, neomycin, polymyxin B, bacitracin, or chloramphenicol are frequently used, especially for surface stuff or alongside systemics. For those congenital issues like entropion, topicals are used until surgical correction. And for those deep medial cancel pockets, regular flushing is important.
What if the cause was trauma, like a cut?
Then you'd likely use both topical and systemic antibiotics to prevent and treat infection.
How about for allergic causes, especially that staph hypersensitivity?
Often a combination approach. Systemic antibiotics plus corticosteroids like prednisolone usually taper down over time to control the inflammation. For really tough cases, systemic cyclosporine might be an option.
And what about treating those infected meibomian glands specifically?
Oral antibiotics like tetracycline, doxycycline, or cephalexin are often used for several weeks. These are lipophilic, meaning they get into fatty tissues well, and they can help reduce those bacterial lipases we talked about.
Ah, so they help normalize the gland function too.
Potentially, yes. Topical combinations like polymyxin, neomycin dexamethasone, or the immunosuppressant tacrolimus ointment can also be used. And remember to check for that Demodex ingeamite too. Sometimes for really refractory staph hypersensitivity cases, injections of a staph bacterin, kind of like a vaccine, might be tried.
So many options depending on the specifics. What about fungal or parasitic causes?
For fungal like ringworm, long-term topical antifungals myconazole, clotrimazole, maybe diluted povidone iodine washes. Avoid lotions for Microsporum canis. For parasites like Demodex or mange, you treat the underlying infestation with the appropriate antiparasitic drug.
Makes sense. And if you don't know the cause, idiopathic cases.
Often, a topical antibiotic-steroid combo, like that polymyxin neomycin dexamethasone, can help control the signs. Sometimes systemic steroids or antibiotics might be needed too, even without a confirmed infection, just to manage the inflammation.
Okay. It's clear the treatment has to be tailored. Are there definite don'ts medications to avoid in certain situations?
Yes, absolutely.
Yeah.
Big one. Never use topical corticosteroids if there's a corneal ulcer. It can make it much worse. And steroids can potentially worsen FHV1 in cats.
Crucial point.
Also, oral tetracycline or doxycycline shouldn't be used in young growing animals because it can affect teeth and bone development. And as mentioned, if you suspect neomycin is the irritant, obviously avoid topical products containing it.
Good warnings. Any precautions for the person applying the meds?
If you suspect contagious parasites like sarcoptic mange, wear gloves. Be careful not to poke the eye when applying eyelid medications. Using an artificial tear ointment before applying potentially irritating skin beds to the lids can sometimes help protect the eye surface. And there's that rare risk of anaphylaxis with the staph bacterin injections.
Okay, safety first. Once treatment starts, how do you track progress? What's the follow-up like?
It really varies depending on the cause and treatment. For bacterial infections needing antibiotics, you're usually looking at least 3 weeks of treatment, maybe longer. You should see some improvement within, say, 10 days.
And if it's not improving?
Common reasons for failure include the antibiotic dose being too low, not addressing the underlying predisposing factors like that entropia needing surgery, or stopping the medication too soon before the infection is truly cleared. Got to stick with it.
Right. Compliance and addressing the root cause are key. Can you prevent blepharitis?
Prevention is entirely dependent on the cause. If it's a congenital lid defect, surgery might prevent recurrence. If it's allergies, managing the allergy is the prevention. If it's hypothyroidism, treating that helps. So, no single magic bullet for prevention.
Understood. What happens if blepharitis isn't managed well? Are there long-term complications?
Yes, definitely. Scarring of the eyelids, cicatricial changes can lead to permanent problems like trichiasis, hairs rubbing the eye, ectropion lid rolling out, or lagophthalmos, can't close the eye.
So scarring can cause new problems.
Exactly. Spastic entropion can happen just from the pain and spasms. Severe discharge can map the eyelid shut. And losing that healthy mebum from the glands can lead to a poor quality tear film, causing dry eye issues. And of course, recurrence of bacterial infections or FHV1 flare-ups is always a possibility.
Those sound quite serious. It really underlines the need for proper treatment. So, wrapping up, what's the general outlook?
The prognosis.
Like everything else with blepharitis, it really depends on the underlying cause. Simple bacterial infection caught early. Prognosis is likely good with appropriate treatment. Chronic allergies or FHV1. It might be more about long-term management and control, so the prognosis for a complete cure might be more guarded.
Okay, so the big takeaway here is that blepharitis might look like just sore eyelids, but wow, it's actually a really complex condition. So many different causes, different ways it presents. Absolutely. It requires digging deep, careful investigation to figure out the root issue. You can't just treat the surface signs.
You really have to consider underlying health, breed, environment, the whole picture.
Exactly.
And while treatment is often possible, owners need to be prepared, especially with chronic stuff like viruses or allergies, that it might be more about long-term management than a quick fix.
That's a really important point, managing expectations.
It really is. And, thinking about how complicated even this seemingly localized issue can be, it makes you wonder, doesn't it? What other common health problems out there have these surprisingly intricate causes that maybe we don't always think about?
That's a great point. It definitely highlights how interconnected everything in the body is and how important it is to look beyond the obvious symptoms sometimes.
A perfect thought to end on. Thanks for unpacking all that detail with us today, and thank you for joining us on the deep dive.